Dr. Dominick DeFelice from Highland Family Medicine is back with us. Doctor, it's great to have a few minutes with you. Good to see you.
Good to see you too. Thank you, Mark.
Boy, an important topic we want to talk about this morning. It's burnout and personal wellness that goes with it. There's been a lot of talk about burnout lately, as you're well aware. Let's define it. What is burnout and how does it affect people?
That's right, Mark. Certainly a well-recognized and important issue, and more so it feels like during the COVID pandemic. So burnout's described as physical or mental exhaustion or collapse, usually due to overwork and stress. It leads to higher rates of things like depression, anxiety, substance use. And it's well documented that we've been seeing an increase during the COVID pandemic, particularly amongst healthcare workers.
I wanted to ask you about that. Do we have any feel for just how many healthcare workers are feeling burned out, or who is at the highest risk for this?
Yes, we do. So there was a great paper in the spring of 2021 that was actually conducted a year prior, so really at the start of the pandemic, that looked at 20,000 healthcare workers in all fields, so physicians, nurses, medical assistants, social workers, and it surveyed them essentially on burnout. And they had a couple of really interesting findings. The first, that even at that early stage of the pandemic, about 49% of all healthcare workers met criteria for burnout. And they also found that the highest rates were found amongst social workers, nursing assistants, and medical assistants. And they also found that racial minorities were more prone to this than whites.
What are the implications here, especially when we consider just how critical healthcare workers are now more than ever?
We're seeing, unfortunately, a lot of people leave the healthcare workforce because it just is not sustainable and not something that people can put their bodies and their minds through for years on end. So we're seeing people change fields entirely. We're seeing people retire early, and that really does make it tougher on the people who are left behind.
If someone is burnt out, feeling this way, what can be done?
Well, the first thing to consider is if there is a true medical issue happening as a result of the burnout. So if someone is depressed or is on substances, all of those types of things need to be treated by a trained professional. Burnout in the absence of those things, so chronic fatigue or stress that hasn't led to those other things, that's really up to the individual, but there are a number of things that can be done. So individualized behavioral health counseling is a fine option. Things like someone just recognizing the burnout and themselves focusing on their diet, their exercise, their sleep. And then in some instances, things like mindfulness and meditation can help. And the last thing I'll say is that there are plenty of apps and websites that can help people be mindful and be good meditators and be living in the moment. So I plug all of those too with my patients.
Well, we appreciate it, Doctor, all of this. Thank you. If you missed any of our conversation with Dr. DeFelice, we'll have it online at rochesterfirst.com.